Hello, the topic of our today's lecture is features of caring for the patient with respiratory, circulatory, and digestive system diseases. To talk about care of the patient, first of all, we must know problems which may be of the patient with respiratory system diseases. Any problems of patient is called as complaint. And I want to show you main complaints of the patient with respiratory pathology. First of all, patient can complain of cough, dyspnea, difficult breathing, attacks of asphyxia when the patient feels severe problems with breathing or suffocation. If it appears suddenly, it is called asthma. Patient with respiratory system feels sudden attacks of asphyxia due to spasm of bronchus, which is characteristic for such disease as bronchial asthma. Patient can complain of cough with blood, which is called hemoptysis. Cough, blood. Expectoration of blood with cough is called hemoptysis. And sometimes patient can feel chest pain, especially due to involvement in pathological process pleura. Because from anatomy, lung and bronchus are free from painful nerve ending, and only when the pathological process spreads on pleura, which is very rich with painful nerve ending, patient feels discomfort or chest pain. Cough is first response of the bronchus on the presence of any foreign tissue inside them. It may be inflamed mucus, it may be any foreign body, for example, growths of tumor. Sometimes you can feel cough when you inhale some dust or sometimes some pieces of food can go unusual way, and you immediately feel cough, which appears as protective response of bronchus. Cough divided on two groups, dry or moist. If the cough non-effective without expectoration of sputum, we are talking about dry cough. If the cough accompanied with expectoration of sputum, we are talking about moist cough. If our patient with dry cough, it severe fatigue him, and usually we must stop this cough because it's not productive. No, doctor can prescribe special medicines which depress coughing center. But today we are talking about pre-medication helpness or primary helpness, which may be given younger and medium medical personnel. And if the patient have dry cough, we can recommend him hot drinking. It may be hot tea, milk, or any other solution. Hot drinking slightly decrease intensity of dry cough can help the patient and sometimes may be completely effective. Our patient with moist cough with expectoration of sputum. In this case, first of all, we must give him some container on which patient can collect expectorated sputum, because sputum is very rich with some bacterial agent, and if our patient with tuberculosis, bacterial agent must be hold in special container and utilized with special order to prevent spreading infections to other peoples. We can give some medicines and we can prescribe some physiotherapeutic procedures, for example, inhalation with some medicines which dilute sputum, and sputum is expectorated, respiratory tract moistened, bronchus dilated, and condition of the patient becomes better. Dyspnea, problem with breathing. For the patient, it is difficult breathing when the patient cannot comfortably inhale or exhale, or his breathing becomes very fast. For the doctor, dyspnea is any changing of breathing, maybe change in rhythm, rate, depth. Normally, our breathing deviates from 16 to 20 breaths per minute. If the breathing becomes often, we are talking about tachypnea. Usually tachypnea appears due to affection of alveoli when the pathological process localizes into the lung. Now, if you compare these pictures, you see empty elastic alveoli easy expanded during inhalation and collapse during exhalation. This process uncontrolled and patient easy breathe. If the alveoli filled with some pathological substances, for example, it can be inflamed mucus, patient with pneumonia, you understand. Empty space for air progressively decreases. As a result, patient cannot adequately inhale, and gas changing through the affected alveoli also becomes difficult. As a result, patient and organism feels hypoxia, which is immediate impulse to the respiratory center which intensifies breathing due to affected alveoli. It is possible only due to increased time of breathing. Patient breathes faster. We are talking about tachypnea, when the respiratory rate becomes more than 20 times per minute. Opposite condition, bradypnea, when the patient breathes less than 60 times per minute. Usually, it is correlated with pathology of brain due to depression of respiratory center. No? For example, it may be patient with brain stroke, damage of vessels, and hemorrhagic absorption into the brain. Bradypnea, when the respiratory rate becomes less than 16. Patient with pathology respiratory system feels difficult breathing due to pathology of lung and pathology of bronchus. How can we help him in this case? No, first of all, we must intensify air ventilation and change position of the patient, slightly raise his head. We can put additional pillow and slightly raise head of the patient, that breathing becomes easy. We said with you about sudden problem with breathing, attacks of asphyxia, which is characteristic for bronchial asthma, which appears due to spasm of bronchus. And if you compare this picture, you see healthy bronchus with normal lumen through which air is inhaled and exhaled, and patient with bronchial asthma, bronchus narrowed due to non-adequate response because affected bronchial epithelium. And you understand through the narrowed bronchial lumen, air inhaled usually, but difficulty exhale, and patient feels difficult breathing. Usually it appears suddenly as attack. How can we help this patient? First of all, patient with attacks of asphyxia immediately change position, completely sit in position, which is called orthopnea. And usually he slightly press up extremities on any stand. It may be bed, it may be chair. It is needed to raise diaphragm and intensify process of exhalation. To dilute bronchus, because our emergency aid must be directed on relaxation of bronchospasm. For this purpose, we'll use portative inhalator with special medicines. But we can correctly give the patient this inhalator. For this purpose, we'll shake it, open inhalator, turn and put near the mouth of the patient, ask him actively inhale and push 1 or 2 times to move the medicine inside the bronchus, which immediately relax bronchus and relieve attack of bronchial asthma. Hemoptysis, which is expectoration blood during breathing. Usually it appears due to tuberculosis or canceromatous process which localizes into the respiratory system. Patient afraid blood and we must immediately help him. Hemoptysis may be insignificant when the patient expectorates small pieces of blood or may be profuse when the patient during cough immediately expectorate fresh blood due to damage of large vessels. To help the patient with hemoptysis, first of all, we must give him some container. It may be a kidney-shaped basin. It helps control amount of expectorated blood because depending of amount of blood which lost during coughing will determine type of our healthness. We can stop hemoptysis with tablets, with injection, or some patient needed blood transfusion. Then we must change position of patient. If the patient can sit, must be erect, sitting position. If the patient very weak, we must turn him on side to prevent regurgitation of the blood into the respiratory tract, into the digestive system. All expectorated blood must be easily removed. And if you remember last lecture when we said about simple procedures, in case of bleeding, we'll use cold procedure and more effective ice bag, and we'll use some pieces of ice or very cold water. Cardiovascular pathology. Cardiovascular pathology also patient needed some our attention. And again, we'll start from main problems of the patient which needed our attention and sometimes emergency aid. First of all, patient complains of pain in the heart region. He can feel heart contraction. In this case, we are talking about palpitation. When the heart contraction becomes arrhythmic, we are talking about intermissions. Patient with heart pathology can feel dyspnea, difficult breathing, because from anatomy you know normal oxygenation of our organism and tissue depends from activity both respiratory and cardiovascular system. Some problem with alveoli or some problem with blood flow provoked disordered gas changing, disordered circulation of the oxygen to organs and tissue. Patient feels hypoxia. Organism immediately send impulse in central nervous system to activate the activity of respiratory center. Patient with heart pathology sometimes can feel sudden attacks of asphyxia, but if in respiratory system pathology we said about bronchial asthma because cause of asphyxia was obstruction of bronchus, patient with cardiovascular pathology attacks of asphyxia is called as cardiac asthma because problem into the alveoli due to slower passage of blood or sometimes congestion is in lesser circulation, blood absorbed into the alveoli. Its expansion and gas changing becomes difficult and patient feels sudden attacks of asphyxia. Edema, which is delay liquid inside our body and first of all in subcutaneous fat tissue. Later it can hold into the cavities, pleural cavities, pericardium, abdominal cavities, and it is needed our specific attention. Patient with cardiovascular problem can complain of headache, giddiness, sometimes darkness in eyes due to disordered blood pressure, which first of all controlled by activity of the heart contraction and resistance of peripheral vessels. Let's stop on some manipulation which may be effective for the patient with cardiovascular pathology. Now, first of all, patient suddenly lose consciousness. We are talking about abrupt but transient because it's not long standing. After some time, poor consciousness can come back independently. This situation is called syncope, which appears due to sudden decreased blood pressure. It decreased not significantly from norm, but process appears suddenly very fast and our organism sometimes cannot very fast compensatory response on some acute situation. Abrupt and transient loss of consciousness is assessed as syncope. You see, patient suddenly falls. No, I think sometimes you can see such situation. Why can it be? It can be if some people's long time being in a non-ventilated room. It may be result fatigue. No, for example, when you study some material before exam, not sleep during some night adequately, drink a lot of tea and coffee, will be some dysregulation in your organism and first of all in cardiovascular system. And some period blood pressure can be decreased. And first of all, due to brain hypoxia, patient can lose consciousness. Fright and excitation, long starvation, some intoxication and toxicosis of pregnancy also may be provoke factors of syncope. What can you see? Patient falls. his skin becomes pale because constriction of peripheral vessels. If you touch him, extremities will be cold. Body can be covered with cold sweat. No, in any acute situation, first action of any people or medical personnel control activity of vital organs, and from cardiovascular system there are examination of peripheral radial pulse and measuring blood pressure to control activity of cardiovascular system. Pulse of this patient will be small, very difficult exact. We are talking about ready pulse, and will be decreased blood pressure, about which I said you because it is provoke factors of syncope. How can we help this patient? Patient loses consciousness short time, but if nearest any people, we must respond on this situation. Or get care of the patient with syncope. First of all, we must slightly change his position. Rise lower extremities, put pillow from the leg, such that blood flow easy go to the brain, because we remember cause of syncope is disordered brain circulation. We control blood pressure and pulse, will intensify air flow if it appears into the room, open the windows, door. We can sprinkle face and breast with cold water. If we have ammonium, we can bring cotton moistened with ammonium near the patient nose, but we must remember that this solution can provoke burning of mucus, and distance on which we bring cotton must be nearest 10 centimeters from the nose of the patient. We can rub the patient's breast and temples with your hand. We can put hot water bottle on extremities to provoke constriction of extremities vessel and stimulate blood flow to the brain. When the consciousness of patient come back, we can give him some hot, strong and sweet tea or coffee, because this manipulation helps intensify brain circulation. There are principles of emergency aid for the patient with syncope. Next problem of the patient with cardiovascular pathology is edema. I said you edema, it is delayed liquid inside the body, and first of all, it's hold on the lower part of the body, because due to physical law, blood from upper part easily come back to the heart due to physical gravity law, and more difficulty from lower extremities. How can you know about edema? Feel pressed on the tibia. I'll pay your attention, part of the body which is poor with muscles and subcutaneous fat tissue. Will press skin to the bone, and if after our pressure we'll see fossa, it is indicator of edema. How can we help the patient with edema? First of all, we must explain him about more optimal position. Patient with edema, especially edema of lower extremities, cannot sit whole day. We'll explain him that in horizontal position he must rise lower extremities, put pillow or any other substances, it may be a rubber cycle, that blood and together with blood liquid easy moves from the lower extremities to the heart. And if the patient in sitting position, his leg must be put on the chair or any other stand. Exclude long standing vertical position. Next recommendation, patient obligatory must control water balance. He must count amount of excreted urine and intake liquid less than excreted urine. For example, if the amount of urination nearest 1 liter per day, patient can intake nearest 800 milliliters of different solution, because if the intake liquid exceed amount of excreted urine, liquid will be hold inside the body and edema only progresses. And next recommendation, which is restriction of salt, because salt is provoke factors which delay liquid inside the body, and sometimes patient with severe progressive edema will completely exclude salt from diet. We said about dyspnea, which was characteristic both patient with respiratory and cardiovascular diseases. More grave if dyspnea appears suddenly, becomes severe, and patient feels suffocation or other attacks of asphyxia. If you remember, I explained to you, it may be named as bronchial asthma when the attacks of asphyxia appears due to spasm of bronchus, or it may be cardiac asthma because filling alveoli with absorbed blood. But in both cases will be disturbed gas changing, organism feels hypoxia, impulse immediately was sent in brain center. In both cases, we can help the patient with artificial oxygenation of the organism. We are talking about oxygen therapy. And I want to stop on the rules and way of oxygen therapy, which first of all needed for the patient with difficult breathing, dyspnea, and especially with attacks of asphyxia. Oxygen therapy. We can give oxygen which may be held in special cylinders, and I'll pay your attention, oxygen cylinder colorated with bluish color. Oxygen may be held into the specific oxygen apparatus which control oxygen flow, and it may be easily regulated. We can use oxygen tent especially for newborn and small children or patients with disordered consciousness. We can use oxygen chamber when the oxygen given with special pressure and will be absorbed through the all skin of the patient. Sometimes oxygen chamber may be used not only for treatment patient with respiratory, cardiovascular pathology, which is effective for the patient with hepatitis, peptic ulcer, because any pathology needed active metabolism which control this level of oxygen. At home we can use oxygen bag which periodically filled with oxygen, and it's easy use of the patient in home condition. Oxygen can enter in our organism through the special tube and mask from oxygen bag. It's maybe go as aerosol which placed near the sleep children or through the special oxygen tent. It may go into the body through the special tubes which communicated with oxygen apparatus, with oxygen cylinder. Usually it is used for very weak patient and unconscious patient which cannot regulate breathing independently. We can use face mask which will be placed over the nose and mouth of the patient. During this case, oxygen will go through the special apparatus lung motor I said you, which regulate oxygen flow and pressure. And we can use special camera which is called oxygen barometry, which actively used for newborn, which born with different pathology, first of all pathology of respiratory and cardiovascular system, and for adult in any pathology of inner organs which needed active metabolic process and active increased oxygenation of organs and tissue. You see oxygen bag which may be different size and volume from 10 to 75 liter, which before using filled with oxygen which is held into the cylinder or any other special containers. Oxygen into the cylinder is held in 150 atmosphere, but it's go into the organism with 2-3 atmosphere which regulated with special manometer, and doctor or nurse obligatory control oxygen flow. Next order, oxygen obligatory must be moistened, and we whenever use free oxygen for long standing period. Usually we'll use 50% obligatory moistened oxygen because dry oxygen is dangerous for our organism. It provokes burning of the mucus and except helpless you can aggravate activity of the respiratory tract. Normally, air which inhaled moistened into the upper respiratory tract by activity of the nose and mouth mucus, but will give oxygen patient with some heavy pathology, and sometimes patient cannot completely control this process, and oxygen which will be given of the patient obligatory go through the bottle with water, which is called Bobrov's apparatus. Bobrov's apparatus, which filled with water, and first of all oxygen go through the water, and then to the maybe given to the patient. At home, if we haven't Bobrov's apparatus, we can prepare it from the usual bottle which will be filled with water, plastic bottle through which will be passed tube with oxygen, or we must put between the patient oxygen and he decides that it's enough for him. Third impulse into the brain center and it stops the activity. We remember usually patient with dyspnea and asphyxia will give 50% moistened oxygen, which may be used long time. Short time, patient after poison with carbon monoxide may be given 95% oxygen. And one other information, if you remember, we said with you bronchial and cardiac asthma. Bronchial asthma is caused due to spasm of bronchus, and we can give patient usual moistened oxygen. But patient with cardiac asthma problem due to filling alveoli with blood. And if the patient intensify breathing, airflow mixed with blood becomes foamy, resembles procedure when you inhale air through the tube into the glass with water. Water immediately becomes foamy. Same process appears into the alveoli. And you understand this foamy blood moves from the alveoli into the bronchus, and respiratory tract becomes obstructed with foamy sputum. To depress formation of bubbles, oxygen must be passed through ethanol, except water will put into the Bobrov's apparatus or any sac ethanol. Because if the patient inhale oxygen which pass through the ethanol has depression activity on formation of bubbles. And depressed, foamy, respiratory tract becomes empty, patient easy breathe. Last system on which we'll talk today is digestive system. And main problems of the patient with digestive system diseases, and first of all diseases of gastrointestinal tract. Patient complains of pain because inflammation of any digestive organ, stomach, liver, intestine, accompanied with pain. Patient can feel nausea and vomiting due to disorderly digestive process, formation of some intermediate toxic substances which absorb into the blood and irritate nausea and vomiting symptoms. Patient can complain of hemorrhage, bloody vomiting or bloody defecation due to ulcerative process into the esophagus, stomach, intestine, and we can see blood during vomiting or during defecation. Patient with pathology of digestive system have problem with defecation because defecation is final stage of the digestive process. Patient can feel liquid defecation, which is called as diarrhea, or problem with defecation attention. If the patient can be in sitting position, we must hold his head, put some cloth on the chest, and put some basin under to collect vomitous mass. If the patient weak cannot sit, we obligatory put him on side, we said about it, to prevent regurgitation of the vomitus, first of all, into the respiratory tract, because it may be provoke factors of asphyxia or pneumonia. And again, we'll hold head of the patient and put basin. After vomiting, we'll obligatory give the patient some water, patient gargle mouth, clean oral cavity. We can put some drops of acid, it may be lemon juice, and which help the patient and becomes his condition better. After vomiting, we'll again hold the patient on side because vomitus may be repeated and will prevent asphyxia with vomitus. Under the head of patient, we can put some cloth, it may be polyethylene or rubber cloth, and put basin under his bed. Sometimes vomitus must be examined. First of all, it is needed if we know that provoked factors of vomitus was some poisoning with some food, with mushroom, with some medicine, and we must know provoke factors because in some cases needed specific treatment. We'll use antidote medicines which remove toxic substances. In case when we think about poisoning as provoke factors of vomiting, vomitus obligatory collected in special container and sent in laboratory. But in any case of vomitus obligatory must be disinfected before removing in sewage because we are known cause of vomitus. It is possible with cleansing of vomitus container with lime chloride, about which we said during fourth classes. We can put 200 grams of lime chloride on 1 kilogram of vomit. Hold some time, nearest 1-2 hours, then it's cleaned with water and maybe removed in sewage. Especially vomitus disinfection is needed if the vomitus is caused by any specific infectious process. Care of the patient with hemorrhage, bloody vomiting. You see, due to canceromatous or ulcerative process into the stomach, blood can come back through the mouth. You see lot of blood. This patient with damage of varicose dilated esophageal vein, or maybe patient with gastric ulcer or growth of tumor and their degradation. First of all, this patient needed strong bed regimen. In period of active bleeding, position of patient on side will put obligatory bathing because will control amount of blood. I said you, depending of lost blood, will prescribe definite treatment. After finish of bloody vomiting, patient sometimes some days needed strong bed regime. First hours after bleeding, we forbid eating and drinking. Obligatory prepared blood group kit because patient maybe needed blood transfusion, and we'll put ice bag on abdomen because we remember cold procedure constrict vessels and decrease bleeding. Doctor especially prescribes the patient some medicines which stop bleeding and intensify blood coagulation. But today we'll talk about pre-medicative care. We'll remember some pieces of ice put in the rubber bag, covered with towel and put on the abdominal cavity, epigastric region or slightly lower if the patient had bloody defecation. But we remember cold procedure restricted in time. After every 20-30 minutes we must do short break to prevent overcooling. Meteorism. Often problems of the patient with digestive system pathology. Patient feels flatulence of abdomen because gas cannot be easily evacuated along the large intestine, and when the gas hold into the large intestine, abdomen flatulence, we are talking about meteorism because intestine distends and patient feels some subjective discomfort. How can we help this patient? For this procedure, we'll use colonic tube, which is used only in one case long standard meteorism. We'll take disinfected rubber tube with diameter 10 millimeters and length 30-40 centimeters. For this manipulation, we'll need wet venom, oilcloth and bedpan with water. You see rubber tube, wet oilcloth and bedpan with water. Patient position must be on side because through the anus will introduce tube into the large intestine, rectum and slightly sigmoid. At free end of the tube we put into the bedpan with water. But we remember, under the patient will put oil cloth. End of the tube which will be introduced into the intestine must be lubricated with vaseline to prevent subjective discomfort. And it's introduced on the length 10-20 centimeters inside the intestine. Its free end will put into the bedpan with water, which is placed near the bed. Why water? Because water covers unpleasant odor of the gas, which will be removed from intestine. And it's help control situation because if the gas actively removes through the tube, we can see bubbles into the water. It shows that procedure is effective. We can keep tube into the intestine nearly 2 hours. Then it must be removed. In any case, effective, not completely effective, because if we put tube longer than 2 hours, it's pressure on the intestinal wall, compress vessels and can provoke ischemia of the intestine and formation bed sores, about which we said on last lecture. Gastric lavage, manipulation which helps clean stomach. When this process disturbs, because normally all contents of stomach evacuated downwards through the intestine, and affection of digestive process control with defecation. But in some cases, due to poisoning, when the content of stomach must be immediately evacuated to prevent progressive poisoning of the body. In case of atony of the stomach, when the muscles of the stomach loses its contractive and motor activity and all content of stomach hold inside. And in case of pyloric stenosis, when the end of the stomach, pylorus, close due to progressive prolonged spasm or due to growth of tumor which completely obstruct pylorus, and intake food cannot be evacuated downward, cannot go into the intestine and evacuated from the organism usual way. This group of patients needed our help. This will clean stomach artificially, or other word, remove its content through the mouth. But every procedure has indication and Contraindication. Gastric lavage cannot be prescribed patient with attacks of stenocardia, which is periodic heart pain due to spasm of coronary vessel, because when we'll introduce tube into the esophagus, we can irritate nerve ending, which innervate heart and provoke abnormal spasm of coronary vessel and attacks of stenocardia. This manipulation contraindicated patient with liver cirrhosis, because in these diseases may be dilated esophageal vein and our tube can easily rupture and provoke esophageal bleeding. Patient with arterial hypertension and patient with visible stomach bleeding. For this manipulation, we must prepare equipment. First of all, we needed sterile disinfected gastric rubber tube with diameter 10 millimeters and length nearest 1.5 meter. We must take funnel 0.5 or 1 liter capacity. We needed 8 to 10 liters of boiled water, temperature slightly lower than our body temperature, because it can intensify contraction of the stomach. Usually we'll take water with 28-32 Celsius degree. We must take bucket for irrigation water and oilcloth apron. You see tube with funnel, one bucket with water and empty, and oilcloth apron. Manipulation resembles order of or law of connective weather. You see stomach, yeah? Then we'll introduce tube into the stomach, and when the funnel will be above level of stomach, water easy go into the stomach, and initial level of the funnel will be on the level of stomach and then gradually moves before mouth. Then we carefully move inside, and when the funnel becomes lower than stomach, water from the stomach easy go out. We'll repeat this procedure sometimes before clean water. Other word, when the water will be removed, completely resembles water which introduced. If the patient conscious, position of patient sitting, will put oilcloth apron on his chest and abdomen, put some basin or bucket for irrigation water, and then carefully introduce water into the funnel and control that funnel not be empty to prevent passage of gas into the stomach. And when the water from funnel not go inside the stomach, it shows that stomach with esophagus filled with water, we carefully move funnel downward and content of the stomach will be removed. Sometimes at home we haven't special gastric tube and patient can provoke vomitus independently. He intake 1.5 liters of water, then put 2 fingers into the mouth, breath on the tongue and provoke vomiting reflex to remove content of the stomach. No, you see nurse or doctor which will do this manipulation, and I'll pay your attention. I said your rubber tube may be 1.5 meters of length, but it's not show that all tube must be introduced inside the stomach. Before beginning of this manipulation, we must measure length of the tube which needed introduced because we must know the tube hold into the stomach. For this purpose, we'll take end of the tube and from the void process through the ears, we'll measure distance before nose. Each is distance which is specific for every patient depending his height. We put mark and then carefully put end of the tube on the tongue, ask the patient to swallowing movement and tube easy go into the stomach. And when it will be introduced through the mouth and when it will be introduced before our mouth, we'll start our cleansing procedure. You see, sterile stomach zone. I'll remember diameter 10 millimeters and length nearest 1.5 liter. If the patient unconscious due to poisoning and his stomach must be clean, we can do this manipulation in lying position of the patient. Again, first of all, we measure distance on which zone will be introduced. Position of the patient must be on side to prevent regurgitation into the respiratory tract. Then we'll use gauge to fix mouth in open condition and introduce zone on definite length into the stomach. When the end of the zone will be into the stomach, we'll gradually fill stomach with water through the funnel and other way of manipulation, remember named procedure. And I'll remember you, we'll repeat this manipulation before in water. For this purpose, we'll use sometimes 8 or 10 or sometimes 12 liters of water. Next manipulation on which we'll stop today, enemas. This manipulation may be used to clean large intestine from its content, or it may be used with medicamentous purpose. We'll distinguish any types of enema: cleansing, siphon, oil, hypertonic, and medicamental. Let's stop on every manipulation separately. Cleansing enema is prescribed for the patient with constipation when the patient cannot clean intestine independently. For example, your patient complains, I have defecation 1 week or more. But his eating is usual. We'll understand all results of digestive process, all feces hold inside the intestine, which loses definite motor activity and it will be discomfortable for the patient. Cleansing enema is used when we prepare women for labor. That prevent together with newborn evacuation of feces due to active constriction of all muscles and all organs of abdominal and pelvis cavity. Cleansing enema is used in case of poisoning together with gastric lavage and which is needed for preparation of the patient before operation, X-ray, endoscopic examination. You can be informed that now we have some specific medicines which helps clean the intestine without enema. Patient takes some medicines which diluted in 2 or 4 liters of water and intestine will be cleaned independently without enema. Maybe some situation. No medicines. Immediately needed clean intestine, and we must be oriented in all manipulation which may be used to help our patient. Contraindication. Cleansing enema contraindicated. Patient with acute abdomen. When the patient feels severe abdominal pain, are we unknown about its origin. We are talking about acute abdomen when the pain appears due to bleeding, rupture, growth of tumor, obstruction of intestine, otherwise any acute situation which sometimes needed surgical correction. Acute inflammation of anus because cleansing enema will be made through the anal canal. Tumor of rectum in stage of decay, gastrointestinal bleeding, and 4 days after surgical manipulation on gastrointestinal tract. In this case, cleansing enema contraindicated. Equipment for this manipulation. We needed rubber sac, which is called S-mark irrigator. S-mark is water. This describes this manipulation. Capacity from 1 to 2 liters. No, if children, 1 liter. If adult, 2 liters. We needed 1.5 to 2 liters of water with different temperature. I'll pay your attention. Temperature of water will depend from activity of intestine motility. And if our patient with usual intestine activity, no problem with defecation, we are talking about pregnant woman, and we are talking about preparing of the patient to some examination. We'll take water with temperature 28-32 Celsius degree as for gastric lecture. If the patient predilected to spasm, periodically feel severe spastic pain in abdomen, we'll take more warm water, slightly more than temperature of our body, from 37 to 39 Celsius degree. And opposite condition, when the intestine loses motor activity, predilected to atony, will take more cold water, nearest room temperature 20-22 Celsius degree. Obligatory vaseline to lubricate end of tube which will be introduced into the anus, oil cloth and bed pen for evacuation of intestine content. Use CS-mark irrigator which finish with plastic rounded tube which obligatory sterile and boil it after every using. Vaseline, oil cloth and bed pen if the patient cannot independently go to septic. We'll introduce tube into the intestine. It's filled with water, feces diluted. Water stimulate activity of intestine. If problem into the spasm, intestine relaxated. If opposite, it's stimulated and provoke evacuation of feces. First of all, we'll prepare S-mark irrigator. We'll take boiled water with different temperature about which we remember. Then we'll put patient on the left side, under his buttock we'll put oil cloth. Irrigator is placed on the stand nearest 1 meter, nearest 1 meter above the patient, and then we'll carefully introduce end of tube, plastic end, into the anus. First of all, it must be lubricated with vaseline. We'll open clamp to remove some water, know that no gas into the tube, and with rounded movement we'll introduce tube into the intestine. Remember course of intestine. When the tube introduced into the rectum, we'll carefully open clamp and water go into the intestine to dilute feces. If it's very discomfortable for the patient feels pain, we can slightly change position of tube or sometimes needed completely stop manipulation and call the doctor, which will decide will continue or stop this manipulation. When the all prepared water introduced, we'll carefully remove tube from intestine, ask the patient lie 20-30 minutes that water dilute feces, stimulate intestine motility, and then patient can go to the toilet or we put bedpan under his buttock to remove intestine content. Siphon enema, not widely used. It's used for the patient only with stable constipation. In case of poisoning, when the patient unconscious and cannot independently clean intestine, and sometimes may be used as diagnosis manipulation in case of intestinal obstruction. No, for example, no X-ray apparatus which or ultrasound examination which widely used for this diagnosis phase. Contraindication same as for cleansing enema. It is acute abdomen, unknown abdominal pain, acute inflammation or tumor of the anus and rectum, bleeding, and for the after surgical manipulation. Equipment. We needed disinfected rubber tube 1 meter length and 10 millimeters diameter, resemble tube for gastric lavage. Funnel 1 liter capacity, 10-12 liter boiled water with temperature 28-32 Celsius degree, bucket for irrigation water, oilcloth and Vaseline to lubricate end of tube. Manipulation resembles manipulation and order of gastric lavage and same principles communicated with them. We'll carefully introduce tube into the intestine on the length which possible. First of all, it may be 10-15 centimeters. Then put funnel above the body 50 centimeters and filled with water. When the water from the funnel no got out, it shows that intestine filled before obstruction with feces or with feces. Then we'll carefully move the funnel downward and remove content of intestine into the basin. And repeat this procedure before clean water. Otherwise, before water which will be removed, same which was introduced. Same principle as for gastric lavage, but gastric lavage will introduce tube into the stomach through the mouth to clean upper gastrointestinal tract, stomach. Siphon enema is used to clean large intestine. Only large intestine, small intestine cannot be cleaned with this manipulation. And when the content of the intestine gradually removed, we'll slightly move tube deeper inside the intestine that clean large intestine completely as possible. Oil enema is used for steady constipation or to easy remove harsh feces or in inflammation of large intestine with medicamentous purpose. Contraindication, same as for any animals. For this manipulation, we needed rubber balloon, but with capacity 150-200 milliliters, oil cloth with the linum, and any vegetable oil. But I'll pay you attention, it's obligatory must be warm, slightly more than body temperature, because we needed that oil hold inside the intestine. If you take temperature lower than intestine, it can stimulate motor activity. In this case, not needed immediate evacuation of intestine content. Will introduce oil. It's hold sometimes. Usually this manipulation is used before night sleep, in evening, and in morning patient easy go to the toilet and evacuate feces. Or if we'll introduce oil with medicamentous purpose during night period, it's lubricate intestine and intensifies calcium process. Hypertonic enema. Prescribed for the patient with a tonic constipation because it stimulates motility of intestine. Especially it's widely used patient first period after surgical treatment because anesthesia depress motor activity of intestine, and to activate its activity we can use hypertonic enema. And in case of paresis intestine after some surgical manipulation or after brain stroke, when there will be complete disbalance between central and vegetative nervous system. Same contraindication as for any enemas. We'll prepare rubber balloon, small capacity, 50-100 milliliters enough, oil cloth with linum, and 10 or 25% solution. It may be 10% sodium chloride or 25 magnesium sulfate. Magnesium sulfate, which introduced with enema, is stimulator agent for intestine peristalsis. Order same as for any enema, tip of the enema lubricated with vaseline, carefully introduced into the rectum and carefully push on the balloon which filled with any hypertonic solution, and I'll pay your attention. We'll push on the balloon, all solution moved into the intestine, then will not relaxate balloon, will constricted condition will remove balloon and then relax it, because if you relax balloon into when the tube into the intestine, all intestine content again come back into the balloon and your procedure will be non-effective. Medicamental enema. With enema we can introduce medicines with local or general purpose. Local, when we'll introduce some medicines which must hold into the intestine, when the inflammation localizes in the rectum or sigmoid, because not needed take medicine through the mouth. You'll understand, before rectum, its active properties will be lost on 50 or more percentage. If pathological process localizes into the rectum or sigmoid, we can introduce medicines with special medicamental enema. We can use medicamental enema with general purpose. No, for example, very weak people or people with acetonemia. We can introduce alkaline solution to change pH of the blood, because medicines very easy absorbed through the rectum, not pass through the liver, and its activity not decrease. We can introduce some water-soluble vitamins and minerals and glucose through the rectum with feeding purpose. but it's used rare case only for very, very weak patient, of which nutrition through the mouth difficult, and to prevent hyperhydration of the organism, because this patient may eat only, maybe eating is possible only with parenteral nutrition, about which I'll say slightly later. We can use general or medicamental enema. For this purpose, we'll use rubber balloon, not high capacity, from 50 to 200 milliliters. With local, usually 50-100 milliliters is enough, because we not needed intensive dilation of the intestine. With next, it's stimulation motility. We want that medicine as possible long hold inside the intestine, and usually this manipulation used during evening period before sleep. No oilcloth, vaseline to lubricate end of enema, and some medicamental solution body temperature, because we remember not needed stimulation of motor activity. Medicine must be hold into the intestine long time. You see different size of rubber balloon, vaseline, oilcloth, and some specific solution which may be introduced with medicamentous purpose. Sometimes this manipulation may be prolonged. We'll introduce solution very, very slowly, drop-like order, will regulate speed of medicine flow, and it's introduced during definite time. No, sometimes if no rubber balloon, for this manipulation we can use plastic syringe with capacity nearest 550 or 100 milliliters, which communicated with short rubber tube, and we can do this procedure, or the introduction of tube or rubber balloon into the intestine, same as for any enema. And I finish our today's lecture on the questions of nutrition of the patient, because it's tightly connected and it's effective depending from activity of digestive system, gastrointestinal tract, and main gland of the digestive system, liver and pancreas. Nutrition of the patient must be rich with different elements, and usually during one day we needed nearest 400-500 grams of carbohydrates, because carbohydrates are energy, source of energy, our organism, and they must be rich with dietary fiber, which control motor activity of intestine. We needed nearly 100 grams different fats, because fat is needed for protection of our organism, each structural elements of some enzymes, and building material for coating of cells. 150 grams of protein, which is main building material of our organism. We needed vitamins and minerals, which may be taken together with table salt, which not needed lot amount, 10 grams is enough, because other vitamins and minerals presented in together with in different food. And our organism needed nearest 1,500 or 2,000 milliliters of fluid, which is usual components of our nutrition. Different factors regulate our nutrition, and first of all, its effect depends from appetite. If the patient feels comfortable condition after feeding, he will have good appetite. If after eating he feels some discomfort, you understand, appetite will be decreased. Our feeding depends from our financial status, geography and region, our life, culture and media, social circumstances, age and individual preferences, and some illness disturb our normal nutrition and needed some special diet. No, in different countries use different rules for dietary recommendation, but general uh, order is same because it depends from disease of the patient and depending each will restrict some food and recommend other food to intensify some or other metabolic process. Our dietary recommendation, no, we are talking about sick patient, tightly correlated with drug intake because some food restrict activity of medicines and depress the absorption. Other food intensify absorption of some medicine. And when we prescribe the patient or give some dietary recommendation, we'll obligatory ask him about medication because some medicine must be intake before eating or after eating, and all this process tightly correlated. If we are talking about feeding, we distinguish three order or way of feeding. Enteral, when the food enters through the mouth and go with usual way. It is usual feeding of the patient, or we can introduce food through the special zone, which will be introduced through the nose if long time, or through the mouth if 1-2 times during treatment. For this purpose, we'll use special feeding which diluted into the water, and because it is introduced through the thin tube. But all food which intake through the oral cavity and go through the gastrointestinal tract with usual way is called enteral nutrition. Enteral nutrition. Sometimes, due to pathology of oral cavity or esophagus, food may be introduced through the stomach opening, which made immediately into the stomach or duodenum, because all digestive process possible only into the stomach or duodenum. But all this feeding will be enteral. Food digested into the gastrointestinal tract and evacuated with usual way. Parenteral feeding is needed for the patient which enteral feeding contraindicated or patient unable to take food usual way. All nutrition elements will be introduced immediately into the circulatory system. No, you'll understand there are different solutions of minerals, vitamins, fat, protein, carbohydrate solution. You understand parenteral nutrition is indicated for heavy patient which unable take food usual way, or digestion of food into the gastrointestinal tract impossible. For example, complete gastrectomy with problem with duodenum, and patient needed only parenteral feeding. We can use nutrient enema, about which I said you, but we must remember into the rectum may be absorbed only water-soluble elements. There are some minerals and vitamins and carbohydrates. We can use nutrient enema only to give into the organism carbohydrate is assimilable, usually it is glucose solution, and some water-soluble minerals and vitamins. To organize feeding in therapeutic or any other department must be special diet order form, which will be spelled of word not depending direction of doctor, and no, we distinguished any therapeutic diet or dietary tables. In some countries, it may be regulated. It may be regulated. All dietary recommendations tightly correlated with patient disease. We'll use usual 15 tables for patients without problem, gastrointestinal tract or any severe diseases, or in some pathology we can prescribe one or other table which restrict some food and recommend any food more widely. More completely, you will talk about dietary nutrition on practical classes. Every diet has individual characteristics depending on indication and purpose. Each has general characteristic. Obligatory will pay attention on chemical composition and caloric content, especially if we'll recommend any dietary treatment for the patient with obesity or cachexia. It's obligate, any food obligatory must be given with definite regimen, more optimal, 4 times per day. No, some patients need it more often feeding. All these recommendations may be shown in special list where will be shown number of diet and dietary notes oriented in this problem, or we can show what food obligatory must be restricted, what food are recommended. And at the end, I will stop on the feeding weak patient, which unable independently go to dinner room. Feeding will be into the bed. There are patients which on strong bed regime will use special bed table, maybe use special caps, patient from which patient easy can take a solution. Usually it is for very weak patient which unable eat independently. If the patient can eat independently, only bed table is enough and will give usual food. But we said with you, if the patient needed additional attention, food must be easy assimilable. We must remember about predilection of patient of some food, and nutrition must be during period when the condition becomes better. If the patient unable to eat independently, nurse or nurse assistant helps the patient, will give liquid or semi-liquid food with optimal temperature and optimal physiological properties. And obligatory, we remember about definite caloric order. That's all information which I want to give you. Thank you for your attention. All questions you'll obligatory will clear during practical classes. Then will be a summer practice on which will again improve your knowledge about order care of the patient. Today was last lecture. All other questions you clear during practical classes. Goodbye. Be healthy.